My name is Dr. Nathan Way, and I'm a physician who specializes in treating people with arthritis and tendinitis and helping them avoid surgery by using the body's unique ability to heal itself. So, what motivates me? Well, there are two things actually. The first is that one of my sisters developed rheumatoid arthritis about 25 years ago and went through a terrible time before finally getting things under control. The pain she suffered was awful, and before she got the disease, she was really active. She ran, biked, tap danced, rollerbladed, and played the piano. After she came down with rheumatoid arthritis, she couldn't do any of those things. And then shortly after that, one of my kids developed juvenile arthritis when he was 10 years old. Before he got the disease, he was playing travel soccer. But after he got it, there were days, literally, where I had to carry him from his bed to the kitchen so he could eat breakfast before going off to school. Those two experiences had a profound effect on me. I made it my crusade to develop more effective therapies. Things were so bleak at first, but got back on track once my sister and my son got on the right treatments. Treatments, ironically, that I had a hand in developing through clinical research. Yet, I was still frustrated because of the lack of effective therapies for the most common conditions associated with wear and tear of cartilage and tendons. As luck would have it, two mentors came along. One who taught me arthroscopy, the ability to look inside a joint with a small telescope and remove damaged and diseased tissue. And the other, a person who taught me diagnostic ultrasound, a tool to visualize tendons and other soft tissues. Both my mentors told me I should use these tools to develop effective treatments for the disorders that affect baby boomers, wear and tear arthritis, also known as osteoarthritis, and tendinitis. I was afraid though, because I knew many others had tried and failed. Somehow though, I overcame those fears, and finding effective therapies for these conditions became my passion. And the results over the last 6+ years have been extremely gratifying. Many of my patients have been active athletes who were told they needed joint replacement. But guess what? They responded to my treatments and didn't have to have surgery. I use growth factors found in blood cells called platelets, platelet-rich plasma, and stem cells to heal cartilage and tendon disorders. These are natural extensions of the body's own healing process. This not only helps with symptoms, but it often prevents the need for major surgery and joint replacement. I bring a unique skill set to regenerative medicine. I am the only arthritis specialist elected to the Arthroscopy Association of North America, the Navy SEALs of arthroscopy. My staff and I have performed more than 1,000 PRP and more than 100 stem cell procedures to date using both arthroscopic as well as ultrasound guidance. We have a number of publications in the medical literature. When it comes to regenerative medicine, I'm a sponge. I'm constantly studying new techniques, what the latest research findings are, what the most promising approaches might be, so I can deliver the very best up-to-date techniques and therapies to my patients. The biggest misconception most people have about arthritis and tendinitis is that they either get cortisone shots or have to undergo major surgery. And that's totally wrong. Cortisone is a destructive band-aid. It may help short-term with symptoms, but it actually weakens cartilage and tendon tissue. And major surgery, particularly joint replacement, carries many risks. It doesn't have to be that way. Regenerative therapies can repair damaged and degenerated tissue and even make new cartilage and tendon tissue without resorting to the knife. If you have either osteoarthritis or tendonitis and are suffering but want to avoid major surgery, I invite you to join me on the journey to recovery. All you have to do is click on the button next to this video and you'll get instant access to publications and videos on the topic of regenerative medicine. Thanks for watching.